evening. This is All India Radio Kohima. I'm Nabin Pradhan with the evening news, and these are the headlines. Nagaland Chief Minister Neiphiu urges all to come together and work unitedly during these exceptional times, assures care and protection for citizens. Plasma therapy dropped from India's corona treatment protocol. High-powered committee on COVID holds virtual meeting with district task forces in Nagaland, reviews COVID-related issues of the districts, and registration portal for vaccination of 18 to 44 years slated for next week to be activated by 9 a.m. tomorrow. As the number of COVID cases are on the rise, we appeal to our listeners not to lower the guard, follow all the precautions, and all those above 45 years who have taken the first dose of COVID-19 vaccine to get vaccinated with the second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. Now the news in detail. Chief Minister Neiphiu has sought the cooperation of all citizens to ensure that the lockdown regulations are not compromised for the sake of one's own safety and health. In a message to the people of Nagaland, Chief Minister Rio said all have to be extra cautious and extremely vigilant so that the disease does not spread to rural areas, which can have far-reaching consequences. He said these are extraordinary times and all need to come together and work unitedly as one. The Chief Minister said the lockdown is creating tremendous inconveniences to us. However, all are aware that this extraordinary scenario demands it and that all should be prepared that the lockdown may even need to be extended if the situation requires it. Stating that the state needs concerted forces of all together and take every possible action in order to combat the challenges that lie ahead, the Chief Minister assured the people that the state government is making all efforts to protect and care for its citizens. While admitting that over the past decades, the state healthcare infrastructure could not reach its desired standards, Rio, however, opined that in the past year, the state has achieved significant development in the health sector. Further extending gratitude to the central government and all other well-wishers for enabling the state government to improve and adding new health facilities across the state, the Chief Minister also announced that within weeks, the state will be establishing a new full-fledged 176-bed COVID hospital in Dimapur and emergency care facilities for the medical fraternity. He said the government is ramping up the vaccination drive with procurement of more vaccines. Acknowledging the contributions of everyone, the Chief Minister appealed to all sections, from church organizations to tribal ho-hos and civil society groups, to political parties and NGOs to rise to the occasion, set aside the differences, and collectively work together as members of one team for the sake of the people. He also extended appreciation to all the frontline workers, especially to the medical fraternity, saying that the medical fraternity, both government and private, is doing commendable work. Rio urged them not to be disheartened during this difficult period, but rather continue to give their best in taking care of the citizens. The Chief Minister also said all can contribute our bit by ensuring that each one of us follows COVID-appropriate behavior in our everyday lives. Rio further assured that as a member of Team Nagaland, we will win this fight unitedly as one Naga family. The centre has dropped plasma therapy from COVID treatment protocol. COVID National Task Force yesterday released new clinical guidelines for management of mild, moderate and severe COVID cases. Plasma therapy does not find a mention under the new guidelines. The decision came on the basis of recommendations of experts from AIIMS, ICMR COVID-19 National Task Force and Joint Monitoring Group of Union Health Ministry. Members of the ICMR National Task Force for COVID-19 met on Friday to deliberate upon the effectiveness of plasma therapy, which gained momentum last year during the onset of the pandemic. However, in the recent meeting, all members of the task force were in favor of removing the use of convalescent plasma from the clinical guidance for management of adult COVID-19 patients, citing its ineffectiveness and inappropriate use in several cases. The Indian Council of Medical Research has said that they will issue an advisory on the matter. You are listening to the news from All India Radio, Kohima. You can also listen to this news bulletin on our YouTube channel, AIR News, Kohima. The high-powered committee HPC under the chairmanship of Chief Minister Neiphiu today held a virtual meeting with the district task forces of all the districts in Nagaland. Government spokespersons on COVID, Minister Niwa Kronu and advisor Monlumo Kikon said the HPC took stock of all the COVID-related issues in the entire district and took note of the tireless effort put in by the respective district task force. The spokespersons said the active coordination of the district task force and the war room will continue in order to address any immediate concerns of the district. On the financial requirement as presented by the DTF, it said the HPC has taken into account the financial matter, and in addition to the existing funds, more will be provided depending on the requirements. The state spokespersons said the government is vigilant and is proactively responding to the needs of each district as per the situational assessment provided by the district task force. It further said preparedness of all the districts with regards to essential commodities are sufficient as of now. Chief Secretary Nagaland J. Alam held a meeting today with church bodies through video conference. The meeting was attended by senior officers, State COVID-19 War Room along with NBCC, Diocese of Kohima, Catholic Church, NCRC and Pentecostal Church. It said after taking the views and concern of the church bodies, the meeting discussed on issues related to education and awareness on COVID-19 and health-appropriate behavior. It said the church volunteers to provide assistance to the management of COVID-19 care centers as support staff and services and training and dissemination of COVID-19 appropriate information. The church leaders further expressed willingness to come forward wholeheartedly to work with the government agencies to fight the pandemic together. The Ausenden has appealed to the Nagaland government for extension of the ongoing lockdown in the state. In a representation letter to Chief Minister Nagaland, the Ausenden, while acknowledging and appreciating the concerted efforts of the state government along with the paramount sacrifices put in by the frontline workers, under the leadership of the Chief Minister, observed that due to the rapid increase of COVID-19 positive cases and the surge in the number of casualties with each passing day, community spread is endangering the lives of the people in the state. The sentence said in order to break the chain of transmission and in the larger interest and safety of the people, it is of paramount importance that the lockdown be extended till the situation returns to normalcy. Also observing that the smooth functioning of different district task force for COVID-19 is being hindered due to financial restraints, the Ausenden further appealed the state government to allocate sufficient financial assistance to all the district task forces. The registration portal for vaccination of 18 to 44 years age slated on 24th and 25th of May will be activated tomorrow by 9 a.m. State Immunization Officer, Health Department, Dr. Ritu Thur said vaccination will be carried out in 24 session sites in the designated COVID vaccination centers of all the districts on 24th of May, having a capacity of 6,000, while vaccination to be carried out on 25th May will have 7,000 session capacity in 28 session sites. He also informed that the slots for Kohima, Mon and Longling have been already booked. However, the portal for all districts will open every Wednesday at 9 a.m. for preceding session sites. Dr. Ritu Thur further informed the public that there are two online categories for registration, one for 18 to 44 years and 45 years and above in the CoWIN portal. And to end the news, a reminder of the headlines. Nagaland Chief Minister Neiphiu urges all to come together and work unitedly during these exceptional times, assures care and protection for citizens. Plasma therapy dropped from India's corona treatment protocol. High-powered committee on COVID holds virtual meeting with district task forces in Nagaland, reviews COVID-related issues of the districts, and registration portal for vaccination of 18 to 44 years slated for next week to be activated by 9 a.m. tomorrow. And that is all we have in this evening news bulletin. Good night.